Life Audio.
Welcome to Christian Natural Health with naturopathic Dr. Lauren DeVille. Christian Natural Health is the podcast on how to get and stay healthy, God's way. You'll hear topics on nutrition, exercise, sleep, avoiding toxicity, meditating on scripture, what supplements to take, stress management, defeating anxiety and worry, how to reconcile Eastern medicine approaches with Christianity, and a whole lot more. Now, here's your host, Dr. Lauren.
Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Ryan Wohlfert with us. Dr. Ryan is a certified mindset specialist, certified chiropractic sports physician, and certified chiropractic biophysics physician, using a specific spinal correction protocol to help patients resolve chronic pain and avoid dysfunction and disease. With 24 plus years of education and clinical experience, Dr. Ryan has helped thousands correct their spine, improve energy and longevity, eliminate dependence on medication, and make simple, healthy, pain-free living possible. Welcome, Dr. Ryan. Thanks for joining us.
Thanks for having me, Dr. Lauren. This should be fun.
Yeah, absolutely. So first of all, let's talk about why. I think most people probably know, but let's talk about why is it important to address spinal health?
I know because I talk about health all the time, especially spinal health, and you talk about health and healthy living. It's like, yeah, everybody knows it, but everybody knows it. I should say that, or, we say that, but do they? Because, knowing is doing and living. And I know we're going to get into some simple, spinal hygiene exercises and things they can do do throughout their day and incorporate them into their day. But that's such a good question to start on, because for people to take care of their health, they have to know why is it important, right? Yeah. And that's essentially what this is, just looking at the big picture. About 2/3 of our population now are in this spinal posture, this distorted spinal posture that it leads to chronic pain and disability, fatigue, even mood problems and anxiety, increased medication use.
Right.
And what's also interesting is that, and this is a connection that not a lot of people make, and that's why I'm happy that you're having me on here so I can help make this connection, is multiple studies have shown that with this, again, this forward flexed posture that so many people are in nowadays, that is screwing up their spines, it actually increases the risk of death from heart disease, lung problems, and from actually all causes. And we'll get into, even when we talk about what is it supposed to look like, right, and then what is this posture, it just puts way too much stress on your whole entire system, your nervous system, your cardiovascular system, your pulmonary system, your gut. So that's how and why spinal health is so important, because your spine should have a certain position to it, a certain shape, but there's a normal range. When it gets outside of that range, similar to there's a normal range for blood pressure, or I should say a healthy range for blood pressure, for blood sugar levels, for hormone levels. It's the same thing with the spine, and the spine is important because it houses, the most important thing functionally in our body, which is, not the brain, but the spinal cord, the nervous system. Right. The spinal cord is an extension of the brain. So that's why taking care of your spine is so important, and knowing how to do it, which we'll get into the how to do the nuts and bolts of it too.
Got it. Okay. So I want to tag team or kind of piggyback off of something you just said, which was the idea that it can affect your organ function. Does this have to do with the spinal nerves being compressed? Is that the concept, or why?
Yes. That's part of it neurologically, because the nerves are getting not necessarily compressed and pinched. I mean, that's a common term that we hear, the nerves are pinched. They're irritated. It creates pressure changes around them. Right. Same thing if your posture or your spine, which I use spine and posture interchangeably, because your posture, it's a window to the spine and nervous system function. Right. So if your posture is distorted, the spine is made up of the individual bones and the discs separating the bones, and out between there, there's this hole, right, where the nerve comes out. Right. So anything that disrupts the flow of that nerve energy coming out of that nerve, which is inside there, from either degeneration, the hole getting smaller. Well,
Right.
now that can quote unquote pinch or irritate, compress the nerves. So neurologically, but then even physically, think about what happens.
Mm-hmm.
Again, most people think of when their posture is horrible is, that forward flex
Sure.
posture. And that's what we're going to mainly focus on today,
Yeah.
because there's actually thousands of different postural combinations that you can get into in spinal distortions. I don't
Right.
want to confuse everybody. Let's just stick with
Sure.
the main ones.
It's simple.
But, the side to side, I know you had a scoliosis expert on previously, so they can, go to that episode and learn about that.
Sure.
But for this forward flex posture, so now mechanically and physically, think about where the heart and lungs and gut are. They're
Right.
in the rib cage.
Right.
So now if we are in this hunched over forward flex posture for prolonged periods of time, it's putting mechanical stress on the heart, on the lungs, on the blood vessels.
Right.
So you're not able to get the air into your lungs. You're not able to pump, the heart's not able to pump like it should and function like it should. So it's both neurological from the nerves, but then it's also mechanical and biomechanical.
Yeah. Oh, that makes perfect sense. Okay, so let's define what a healthy spine looks like first. So can you explain that a little bit more? What are people looking for? What are you trying to correct if something is off?
Absolutely. So when you look at the spine from the front, all right, we want to be straight up and down like a tall building or a tower. We don't want any shifts off to the side.
Mm-hmm.
So how you can look at yourself with that is you want basically the middle of your forehead, right between your glabella, it's called, right between your eyebrows, going down to the middle of your chest. So the breastbone and then your pubic bone, we want all of those lined up with your feet about, if you're standing with your feet about, hip width to shoulder width apart, going right down between the middle of your feet. Mm-hmm. So that's from the front. Now, what we've been talking about is this forward flex posture. So from the side, we want to make sure these points are lined up too, in the fact that you want your ear, again, just for simple terms, your shoulder, the outside of your hip, that bone on your hip, your pelvic area, and then your ankle. We want those in a straight line. So that if we're looking at your posture externally or your spine externally, again, posture is a window to the spine and nervous system. Yeah. So that is a simple way to do that. So it's hard to know, like just by looking at yourself, the side view. You can look in the mirror and see the front view, right? The side view, you could take a picture on your phone, or that's usually the easiest way to do it, is taking a picture on your phone. Yeah. Now, if we want to actually get even deeper into what the spine should look like, because on the inside, the only way to know what the spine is look like is to look inside the body, just like for a mechanic to know what's wrong with an engine. It's got to get in, open the hood. So standing spinal x-rays are actually the best way to do that. Okay. So you can see, all right, in the neck, we want what's called a lordosis. So let me break it down. 3 even curves, one in the neck, one in the mid back, and one in the low back. Yep. So you have a lordosis in the neck. So the neck curve, then the mid back counteracting that or complementing that, going the other way. That's a kyphosis, and then the lumbar lordosis again. And there's normal measurements for each of these, but they're about 40 degrees. They're like 43 equal 40-degree curves. Okay. Now, why these are so important? So we want it lined up, like we said, from the outside, and the inside, we want these 3 beautiful curves. And, God's amazing in how he designed us, right? It's the very first thing to develop was our brain and our spinal cord, our nervous system. Right. And so it's like, why? Well, it's the most important thing. He knows it's the most important backbone thing. Yeah. But to protect this most important thing that we have, our brain and nervous system, the second thing to develop was our skull and our spine to protect it, because it's so important and because it's so fragile. Right. So right there, we know from nature, okay, this is a pretty important thing. Yeah. So when we have the 3 equal curves in the right position, it's centered with gravity. Right. Well, now it protects the spinal cord, protects the nervous system, allows it to relax and deliver all the life-giving energy and communication from the brain down through the spinal cord, inside the spine, through the nerves to every single cell, tissue, and organ.
Yeah.
And so, so that's one thing, like neurologically and just life-giving.
Mm-hmm.
But these curves also provide shock absorption,
Mm-hmm.
right? They
Yes.
they allow the spine to move with gravity and move a lot easier.
Mm-hmm.
It allows, you're not wasting energy and resources by just fighting gravity. Because
Right.
just if you held something that's 15 pounds, and I know you have kids,
Mm-hmm.
but they're probably a little bit too old for this, but when they're babies, I tell parents to do this all the time. Like, you wouldn't hold your baby at arm's length
Mm-hmm.
out away from you, right? For
Mm-hmm.
a long period of time,
Mm-hmm.
because your body be like struggling just to stay upright.
Mm-hmm.
But that's what we're making our body do when our head gets forward and
Mm-hmm.
our, this mid back curve gets hunched over, is it's like we're lifting something that's 15, 20 pounds and holding it for a long period of time. So it's wearing the body out. Now it can't take care of other issues in the body because it's wasting the energy on just surviving in this gravity world.
Mm-hmm. Mm-hmm. Yep, definitely.
Yeah.
And I'm reading a book right now that's called Anti-Fragile, and it's talking about essentially the concept of when there's a stressor, if you're capable of rebounding in the opposite direction, then you have the resilience. In this particular case, it's actually getting stronger with those disturbances, but exactly that idea of elasticity, where your spine is capable of absorbing shocks. And if you don't have that, then you don't have that kind of resiliency, right?
Correct.
Yeah.
And that's a great example. And
Yeah.
now it's just like Anti-Fragile, just
Mhm.
like, I haven't read the book, but that whole resilience part, you come back stronger,
Right.
is one of the issues is it's not like the acuteness of like how much we do this. It's the chronicity with which we get ourselves into these stressful positions, or stressful, like we'll have these stresses on our body for a chronic period of time, like whether it's physical, chemical stress, like the foods that we're eating that I know
Right.
you're so familiar with, and then the emotional and mental stresses.
Hmm.
It's not that having these stresses are bad, but
Hmm.
the excess with which we have them and the accumulation that it has, it makes it hard for our body to bounce back.
Hmm. Sure, absolutely. So if somebody has spinal pain, well, I should say if somebody has back pain, how can they determine, or how can it be determined, whether it's coming from the literal structure or whether it's coming from muscle or fascia or pinched nerve or any of the rest of it? How do you kind of tease those things apart?
You know, I mean, with my background, a lot of times I go back to the spine and the actual structure of it.
Sure.
Like, just look at the structure of it, look at the posture, because
Mhm.
the muscles respond to what the spine is doing. Like, a lot of times people think it's a muscle problem because that's where they feel the pain,
Sure.
right? I mean, there's disc issues, right? There's, especially like with a disc herniation, disc bulge, it can irritate the nerve. So you get the nerve pain going down the leg, or if it's in the neck, it's going down the arm.
Hmm.
So that might be easier to understand, where it's okay, it's a spinal problem.
Hmm.
But even when there's muscle dysfunction, or if it's fascia, or if it's, the tendons or ligaments, whatever, I always go back to, what does your structure look like? What does the spinal structure look like? Because the muscles attach to the spine.
Right. Sure.
And if the spine, and that's one of the benefits of it too, having this strong spinal posture,
Hmm.
is it provides leverage and efficiency for the muscles to work and do their job.
Hmm.
Because if you're like, again, in this forward flexed, hunched over posture, well, now we're putting a chronic strain on the
Sure.
muscle and it's constantly active.
Right.
So we can get massages all we want, which are, great. I mean, I use the foam roll all the time, and different methods of that.
Yeah.
But unless we're addressing and counteracting the the inward, distorted position of the spine where the muscles attach,
Right.
it might not be as long lasting as we had hoped. And
Mhm.
I think a lot of us has experienced that. Like, it
Sure.
feels good when you rub on the muscle, but
Right.
then it doesn't last.
Exactly, exactly. So, and then before we get into some of the exercises and spinal
Yeah.
hygiene and all of that, talk to us about kind of some of the basic things that people do all the time, like the ergonomics of their setup if they're in front of a computer all the time, or their mattress, or things like that. how important are those things, or how not important are those things in terms of overall spinal health?
Well, especially in the world that we live in, especially with technology, because we'll point right to that, how people are just holding their phones. I mean, this goes right into the simple daily activities that we can do. And it's shocking to me. It is and it isn't. I use the word shocking, and funny is my other word that I use to describe sad and all the other different emotions.
Yeah, euphemism.
Yeah, when I see people on their technology, especially their phones, and it's down in their lap. What if they're sitting down? It's down in their lap and they're looking down. If it's on an iPad or a laptop, I mean, it's called a laptop for a reason, I guess, where it's sitting on your lap. But that right there, if you're in this position for longer than 20 to 30 minutes continuously, that's enough time to start distorting and making those changes more permanent in that posture. We use that as the measure also. Okay, so if it's 20 minutes in this position, well, guess what? Now it's 20 minutes. Like, for example, we work up to 15 to 20 minutes of doing these different traction type activities. And we're not even going to get into that today. Well, we might a little bit, but we have to think about it in those terms. It doesn't take hours and hours of being in there. It only takes 20 to 30 minutes for the ligaments to start, holding and tightening and getting fibrotic in that position. So just how we're dealing with our technology. And I'm not going to get rid of my phone. I'm not going to get rid of my computer. This is how we can connect across the world with each other and help people, but we have to use it in a healthy way. Just like food, we have to use food. It can either be good or, we can use it in non-serving ways. So just very simply is pick your phone up. It sounds so simple. It's keep it at, I know you might not keep it at eye level, but at least if you just put your arms down by your side, the upper part of your arms down by your side, bend your elbows at 90 degrees and keep it at least, chest level, chin level, that would go a long way to decreasing the amount of stress on not just your neck and upper back, but your entire spine. If you're sitting, if you're standing. In some people, when I give them this instruction, they're like, well, that looks weird, right? Why does it look weird is because
we're not used to it. Yeah.
Right. So I'm not sure why, this distorted, slumped posture got to be normal and not weird. But it's because so many people are doing it. It gets confused with, it's common, but it doesn't mean that's healthy.
Typical. Sure. Yeah. We're just used to it. No.
Yeah. Absolutely. So that was just one thing you can do right there is that's what, to answer your question, that's why it's so important. Your sleeping posture. A lot of people think, I hear this weekly inside my brick and mortar office where somebody comes in and says, I must have slept wrong.
Right.
I'm more of the philosophy that it's what we're doing during the day that, not necessarily our sleeping and how we're sleeping, but it's the actions and the postures we're taking throughout the day. And also our nutrition, our other healthy living practices that when we sleep, a lot of times these things kind of come out the next day. Very rarely do we eat, I'll go back to nutrition as an example. We don't eat ice cream one day and wake up 20 pounds heavier the next morning.
Right.
So it's an accumulation of the stresses. And sometimes you sleep. And yes, if you're sleeping on your stomach and, with your head turned and not in a good, healthy position for the spine, that can cause crinks in the necks and problems there too.
Yeah. Interesting. So you're really not of the opinion that the mattress makes much difference. It's really about what you're doing throughout the day.
No, I believe the mattress does. I guess I was more with the postures that you're sleeping in.
I see.
Yes, there are healthier postures, but if you're sleeping propped up on pillows, that's not great.
Okay.
For mattresses, I do like more of a firm mattress, ideally. And again, let's get into it here, like sleeping wise, because that's a big question I get is what mattress or how do you sleep? What's the best position to sleep in? Sleeping on your back is actually the healthiest position,
Mm-hmm.
but not propped up on pillows,
Mm-hmm.
right?
Yeah.
I mean, you might just want to roll up a towel and put it underneath
Right under the neck.
your
Sure.
neck. And there's those pillows that have the orthopedic pillows, which have the waves in them, and helps to support these curves in your spine.
Sure.
But you don't want them too thick. And here's where the nuance comes in.
Mm-hmm.
Is I sleep on my back and on my side.
Mm-hmm.
It's hard to find a pillow or a support that addresses both.
Right. Sure.
Right. So basically on your back, you want more of a thin, you don't want much of anything underneath your head and neck.
Mm-hmm.
On your side, you have to have something, or else, if I'm sleeping on my left side, I'm going to be tipping down there. So you need some type of support. And I don't have a specific recommendation for people like get this pillow.
Right.
They have to find that one for themselves that can do both.
Right.
Where
basically what they're looking for is something to support the natural curves, to reinforce it, as opposed to kinking it weird and staying there all night.
Mm-hmm.
Got it.
And just like if you're lying down, you want those same points lined up too: ear, shoulder, hip, ankle.
Right. Yeah.
Same thing if you're laying on your side sleeping. We want a straight line from here, from the middle of your head to your breastbone to your pelvis. A lot of times people put a pillow or something between their legs so it doesn't cause stress on their low back.
Gotcha. Okay. And so for people like desk setups, aside from the phone and all of that, so is it also screen eye level, hands up? I mean, hands are slightly different than all of the rest of this because that's a little bit more muscle, but same concept of like, what are your typical ergonomic recommendations for a desk setup?
Beautiful. Because I'm at my standing desk right now.
Yeah.
I very rarely sit at my stand. I don't ever put it down. It's just easier this way.
Sure.
But yes, whether you're sitting or standing, you want eye level. The screen, about the top third of the screen, right at eye level.
Right. Okay.
Hands and shoulders relaxed. When you're sitting at your desk, I would love people to get into a habit of not even leaning against their desk chair, to almost train themselves to use their own power to sit up.
Sure.
Because no matter how great your desk chair is, you're still sitting. You still want to get up and around. And I don't want it too comfortable, because if you're too comfortable, then you're going to sit there for longer and longer periods of time instead of getting up and moving around. So again, just these little things. But I haven't really found a chair that, like, all right, this is the perfect one. It's when we're sitting, whether it's driving or sitting at our desk or at our kitchen table, we want to sit on our butt cheeks evenly, not shifted off to one side or the other, not hunched over as well, obviously. But those are the markers. We want our feet on the floor. If you're too short to have your feet on the floor, put something underneath that your feet can sit on. I don't mind your knees being slightly lower than your hips when you're sitting. That's actually okay. And if you ever wanted to really get into this, go into it like having a kneeling desk chair, a kneeling chair, I highly recommend those.
Interesting.
But those you have to watch out for, like pressure on your knees too. So it just depends if you have knee issues.
Where the issues are, sure. And then arms resting like 90-degree angle on the table kind of thing?
Yes.
Okay.
Yes. Just relax shoulders. And we can even go over some different exercises you can do at your desk to just help to restore the proper posture and counteract it within a couple of minutes. We can do that.
Let's go there. So what are some of your recommendations?
So one of my favorite is, well, I'll piggyback both of them. I'll give you the easier one and then the more challenging one. So you're sitting at your desk, you put your hands on your knees, right? Sitting up straight. So it's like you're grabbing your knees and you're going to pull your knees, right? Pull your knees with your hands. They're not moving anywhere. But what that does is you're going to stick your chest out, essentially pulling your shoulder blades back, arching your low back as you do this, and then looking up.
Okay.
So you can do that for 5 to 10 seconds and do those reps for about a minute. Or
Okay.
you can hold it for maybe 15 to 20 seconds, but I like shorter hold times
Sure.
in doing reps because one, it helps to increase the circulation going throughout the spine and the muscles of the spine too.
Right.
So that's called like just an extension exercise, sitting extension exercise.
Okay.
Another one, and this one is one of my favorites,
Mm-hmm.
and this directly counteracts this
Right.
hunched over posture. And
Yeah.
it's hard for people to do because of that.
Right.
Now, this one again, sitting down is more ideal than standing up, but you
Okay.
clasp your hands together, put them behind your head and neck.
Right.
Okay. And what you do is there's different checkpoints. So you want to raise the chest up. So it's like you're
Right.
squeezing, sticking your chest out and up, taking your elbows back. Okay. And then pushing your head back into your hands without those collapsing.
Got it. Okay.
So that's like a thoracic extension exercise. So you can, again, oh man, if you do this for like a minute and then you go back, you just feel, just doing that, I can feel the blood flow.
Sure. Yeah.
Now, if you really wanted to take into a more of a mobility exercise, those same things, and now you rotate.
Okay.
Side to side.
Yeah.
But you don't want to lose the chest up, elbows back, head back position. Because what happens a lot of times is they'll start rotating and then the elbows will go like this.
Right.
Okay. So it's just, oh man,
yeah,
just like that.
And
so
5
doing
seconds.
that go ahead.
5 seconds at a time each time as well, like 5-second increments.
That one, I would say you don't even have to hold it for 5 seconds. It's more of just holding for a second.
Okay.
And doing that for, again, 10 reps or so.
Okay. Excellent. Very cool. And so what else in terms of just trying to overall maintain a healthy posture or maybe get back to a healthy posture? You gave us some great ideas. Anything else?
Yes, I love that because you led right into spinal hygiene, or what I call spinal hygiene, to maintain.
Right.
Just like, dentists want people to brush their teeth and floss, and we have dental hygiene.
Right.
Do it every day, usually twice a day.
Yep.
Well, it's the same thing with the spine. And just like brushing your teeth is not time consuming, takes 2 minutes to do. Same thing with spinal hygiene exercises. Like basically we want to take the spine, all the different joints of the spine, in their maximum range of pain-free range of motion every day, at least once a day.
Okay.
So very simple. We can bend side to side. We can flex down and extend up, and then we can rotate the joints of the spine.
Right.
So very simple. And if they go to my website, they can download the spinal hygiene mini class, which explains all of these. Yeah. But just, it's like take your spine, head and neck, and I do them separately for the head and neck, but your spine side to side, again, 10 reps in each direction.
Yeah.
You can rotate. 10 reps in each direction.
Perfect.
Up and down, like the cat-cow exercise. You can do that 10 reps. Terrific. And that would take you 2 minutes to do, just to keep the spine moving. Now, obviously, if somebody has osteoporosis or fractures of the spine, they got to watch out for excessive rotation or extension. That's why it's always pain-free. You go in the decreased range of motion first. You find that, just get used to it, find that point, and then you can build on that.
And so this, I know we're going to talk about this at the end, but could you say real quick what your freebie is, the course that you just mentioned?
So you can get this is a different thing, the spinal hygiene mini class, which I just mentioned, but then also the posture mini course is actually the postural module of a course that I did, and just showing you how to evaluate your posture.
Right.
Okay. Posture and spine, and then based off of that, what exercises to do and how to do them.
Sure. Perfect. Excellent.
Yeah.
So for people that have chronic back pain and they go get MRIs and imaging and all the rest of this stuff, how often in your experience are the findings on there, like they've got spinal stenosis, they've got, herniated disc, all of those things. How often are they the cause of the pain, and how often are they incidental findings versus.
Yeah. That's because there's a study that came out years ago showing that I think 60%, at least 60% of people walking around that don't have even any back pain, if they did an MRI on them, they have signs of, yeah, they find something.
Right.
So it just depends on what symptoms that they're feeling.
Sure.
But that even gets into, being in the field that I am, it is definitely related more often than not when they're feeling the symptoms.
Mm-hmm.
But, there also gets into the brain aspect of it, right? Of, the neural programming of pain in the brain, in these pain centers, if you will. So, I mean, in my experience, I know that the studies and what they show, but then when we get an MRI or take x-rays and it's showing areas of degeneration or arthritis,
Sure.
it is related to that. But what's interesting is sometimes we find people that, they come in with low back pain, and we find more damage and postural distortions and spinal dysfunction up in the neck versus the low back, which, that can be even a mechanical thing too, because of how the nerves and the spinal cord is affected up here. And if you think about the spinal cord like a hose, the main faucet's right up here in the brain. So now if we put a kink in the hose here, and that hose goes all the way down your back to your legs, it can affect that too. But no, that's a great question. And just because somebody has like a finding on an MRI doesn't mean, okay, you have to have pain. That's not always the case.
Right. Interesting. So, and if they do, like, let's say it appears that there is a correspondence between what you find on the MRI, how often do you find non-invasive techniques like some of the things that you're describing to be beneficial enough that they can avoid injections or steroid injections, surgery, all of the rest of that, pain meds, that?
Yes. Oh, very common, but we have to address the underlying structure. We have to address what is causing it in the first place. Right. And I know you're a big fan of the root cause is what is in, I go back to lifestyle. What is, we can do all we can for them and with them and show them with these exercises and how to adjust their lifestyle and showing them different traction techniques to help reform the position of their spine and addressing their nutrition. But if you're not going to change the lifestyle, we can do that for a course of care.
Sure.
And it's going to be successful, but it's just a matter of how can you maintain that?
Right.
How, are you going to maintain that?
Right. Sure.
Not that, because I believe most people listening to this have heard, once you go to the chiropractor, you got to keep going back, which is, I always laugh at that one because, one of my sayings is you don't have to do anything. You just have to you just have to deal with the consequences of what you do and don't do. Right. One of my examples I give is you don't have to pay taxes. And people will say, yeah, you do. Like, no, you don't. You just have to deal with the consequences if they find out. Sure. It's the same thing with our health. You don't have to eat healthy. You don't have to get your spine adjusted. And we want to teach you ways to keep it that way. I'm going to do spinal rehab and spinal hygiene for the rest of my life because that's what we started off with is realizing how important it is. I realized how important it is. When I was 13 years old, I had my first migraine headache. And that's when I started seeing a chiropractor. And I won't go into the whole story. Yeah. But I mean, I saw how that led me to not taking any drugs and never being on drugs and never will be on any drugs. I already put that in my mind that I'm never going to, I'm going to find a way in my lifestyle, whether it's through, obviously my spine, nutrition, exercise, mindset, spiritual growth, to make sure my body is not holding on to those stresses that's causing it to break down.
Right. Yeah.
So, yeah.
That makes sense. So what have I not asked you that you want to make sure that you leave with our audience?
Well, and we've touched on it, but I just want to, one of my ethos is BYOG. It's be your own guarantee.
Okay.
And with the help of God, obviously that's without saying. That's, because when I say that, you're like, well, wait a second. I thought you were a Christian and, we want Jesus' strength. And yes, exactly. But we have to do the work, all right, that he put us there for. And if you want to live a healthy, active, pain-free, drugless life, then you have to be your own guarantee for the things that you do for your body and put into your body. And that includes, what you're doing to your spinal and spinal health, because I know how the spinal health can translate into what you're putting out there in the world, how you're presenting yourself to the world, because it unlocks the biggest power that we have in our body, which is the brain and nervous system. So if we can unlock that, then with these simple, and that's the next thing I want to say, simple and consistent practices, then it doesn't even have to be little by little. It can just lead us into that pain-free, active, drugless, I can't reiterate that enough, drugless life. Yes. And that's my goal. And that was one of the things I said at the beginning with this spinal posture. It leads to increased medication use with that distorted spinal posture. That's been shown with research too, like with opioids and painkillers and even over-the-counter drugs.
Yeah, absolutely. That makes sense. So where can people go to learn more about you and to get access to some of your courses?
Yes. So go to drwohlfert.com. I'm sure you'll have it in the notes, linked directly to that. So if you want to download the Spinal Hygiene mini class, I definitely recommend that. And then also the posture retraining mini course.
Fabulous. All right. Well, thank you so much, Dr. Ryan. This has been very educational. I appreciate it.
Thank you.
Are you looking for a holistically minded healthcare practitioner who truly treats root cause rather than symptom suppression? Unfortunately, even in the alternative healing professions, this isn't a given. That's why I've created wholehealthdoctor.com, a resource to help connect patients to healthcare practitioners in their area who share a root cause philosophy. Alternatively, most of the practitioners listed also practice telehealth. So if there isn't anyone local to you, you can still find a great practitioner to help you regain optimal health. Go to wholehealthdoctor.com. That's wholehealthdr.com. Type in your location or adjust the specialty that you're looking for and find the practitioner who's right for you.
Thanks for listening to Christian Natural Health. This show is run by you, so please write in with topic and guest suggestions for future shows. For more great content, subscribe to Dr. Lauren's blog at www.drlaurendeville.com or follow her on Facebook or Twitter at Dr. Lauren DeVille. If you enjoyed the show, don't forget to share it with your friends and give us a 5-star rating in iTunes. It really helps us to stand out so other people can discover great content as well. Have a great week and God bless you.